Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest is Dr. Brian Swehla. He's a vascular and interventional radiologist for 3 hospitals in the Baltimore region of MedStar Health. And he's here today to talk with us about the Transradial approach, or the through-the-wrist approach to treating uterine fibroid tumors. Welcome to Health Professional Radio, Dr. Swehla.
I appreciate it. Thanks for having me.
Thanks. Now, you're a radiologist for 3 hospitals in a single chain of hospitals. Talk about this hospital chain and how you became involved with them.
So, yes, MedStar Health System comprises hospitals in both Baltimore and Washington, D.C. Mm-hmm. And 3 of the hospitals that are in Baltimore, my group, MedStar Medical Group, radiology, we cover. So myself and one of my partners are involved in covering minimally invasive image-guided procedures for these 3 hospitals. And I got involved with them a couple years ago, sort of on a contractual basis with with the hospital that I used to work with. Mm-hmm. And then this past summer, the MedStar Health System was looking to bring these 3 hospitals in under kind of one umbrella group. And so they asked me to join them. And I also brought on a guy that I had trained a couple years ago. And we've been basically looking to expand the minimally invasive image-guided sort of procedural armamentarium that's, that we have. And, for this health system. So everything from the Transradial approach to uterine fibroids, I was the first one in MedStar to, treat fibroids from the wrist. And that was back in March of 2016. And then we've, been using that same approach for other procedures that we do, minimally invasive treatment for liver cancer. We've also used it for stopping bleeding in a minimally invasive way, both, in everything from the kidney to the liver to the GI tract. We do, a full range of procedures, really everything from biopsies to putting in vascular ports for patients who need chemotherapy to putting in drainage tubes to help drain infections in basically any place in the body. So we are very, sort of multidisciplinary. We cover a lot of organ systems. We work with a lot of specialists everyone from surgeons to gynecologists to internal medicine doctors to ICU doctors, and really have been expanding this range of procedures for MedStar Baltimore.
Now, as the first surgeon or radiologist to use this radial approach, briefly talk about the old standard way of treating uterine fibroid embolism.
Right. So the standard way has been for years to go from the femoral artery. And fibroid embolization started in the early 90s in France. And almost, all angiograms really at that time and really up until the last few years performed by interventional radiologists have been through the artery in the groin, the femoral artery. And interestingly, cardiologists have been using the wrist since the late 80s, early 90s to perform, heart catheterizations. And they had found that it was a lot safer, actually, for the patients who are undergoing heart catheterizations. And then the fact that they were doing it kind of translated into some interventional radiologists using it for areas outside the heart. So in the uterus for fibroids, in the liver for treating liver tumors, even doing, treatments in the renal arteries to the kidneys. And so again, we found that for patients, especially for patients undergoing uterine fibroid embolization, that afterwards there can be a lot of discomfort and cramping pain after the procedure. And to have to lay flat after the standard approach from the groin just sort of added to that inability to find a comfortable position and to, sort of recover, kind of hampered the recovery a little bit. So going from the wrist actually allows the patients afterwards to be able to get up and walk around, to find any comfortable position they'd like. Whereas again, before they were kind of confined to a bed for at least 2 hours minimum, and up to 6 hours, usually on the maximum end of things. So now, they're completely mobile, free to find any position they want to. And what's enabled us to do is have some patients that we send home same day after the procedure.
Well, going through the wrist, you're talking about this approach is safer. Now, I'm looking at my wrist, I'm looking at my groin, and I'm looking where the femoral artery is. I'm looking at the groin. Isn't the femoral artery kind of a big artery, whereas you're going through the wrist? Kind of briefly walk me through this procedure and explain to our listeners why it's safer and more beneficial to the patient, especially when it comes to, I guess, recovery time and discomfort during said recovery.
Right. So one of the it is a smaller artery to use in the wrist, so compared to the groin. So every patient that is going to undergo a transradial, approach has to be screened to make sure the artery is sufficiently big enough not to cause any problems, and that there's good flow to the hand through the other artery in the wrist, the ulnar artery. And we do that by way of a test we call the Barbeau test. And if patients pass that test and on ultrasound the artery is a sufficient diameter, then we know from, looking at the medical literature and the data that there's a very, very low risk of complication. And when it comes to, compared to the femoral artery, a lot of the patients that we're performing this procedure on can be overweight. So in the groin, we're dealing with a lot of tissue often that we have to sort of, from the skin down to the artery, a lot of tissue to navigate. In the wrist, in even, very morbidly obese patients, that distance is rather very small, even, just from the skin to the radial artery. And so what that enables us to do is have an easier access in the wrist compared to the groin, and also post-procedure, when we need to monitor for bleeding, it's so much easier to sort of identify any problems at the wrist rather than, kind of sorting through tissue and moving things out of the way to be able to visualize the groin well. So from that standpoint, from a bleeding standpoint, it's less risky for our patients to go from the wrist. In addition, like I said, kind of from a recovery standpoint, we see these patients, able to get up, move around more quickly. And it's a lot easier to put pressure on the wrist if there were to be some bleeding there, as opposed to them having to hold pressure down in their groin, where it may be harder to feel the femoral artery and be able to, hold pressure on it. Again, just in patient satisfaction has really been, tremendous to sort of see when you have patients that have had a femoral approach to a procedure versus the wrist approach. And most definitely favor, the wrist when asked, and, which they felt was the better experience. And so, again, that's also technically from just a operator standpoint. So from my standpoint, or one of my colleagues' standpoint, it's actually in a lot of ways easier to navigate into the arteries that we need to treat for the procedure, coming from above, so to speak, coming from the wrist and coming down the aorta into the pelvis, as opposed to coming up from the artery in the groin, making, we have to deal with the angle at the aortic bifurcation, and that actually at times proves to be a little just a little tricky. So coming from above kind of eliminates that. And again, in my experience, it's also been made procedures go a little bit more, quickly, not having to navigate some of these difficult angles if I'm coming from the groin.
Now, where can our listeners go and get more information about MedStar Health and this Transradial approach to treating uterine fibroid tumors?
Great. So to learn more about MedStar Health, you can go to the MedStar website, which is, I believe, medstarhealth.org. And in terms of radial access, there is, I believe, askforufe.com, ASK for the number 4, UFE.com is now featuring the Transradial approach on their website. And you can also just Google, radial artery access and sort of learn about the benefits of the procedure. Again, it may be in the setting of a heart catheterization or other, catheterization procedures, but the concept holds, across, again, whether it's uterine fibroid tumors or a heart catheterization or minimally invasive cancer treatment in the liver. There's a lot of advantages for going from the wrist as opposed to the groin.
Well, I thank you for talking with us today.
I appreciate the opportunity.
Thank you much. Thank you. And hopefully you'll come back for some future segments.
Sounds good.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Brian Swehla, vascular and interventional radiologist with MedStar Health. And we've been in studio talking about the Transradial approach to treating uterine fibroid tumors. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.